Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today.
The Love and Leary Podcast is where nursing leadership, innovation, and real talk come together. Hosted by nurse leaders Marion Leary
and Rebekah Love.
The show dives into the issues that matter most to today's nursing community.
Each episode features candid conversations, expert insights, and bold perspectives on healthcare, leadership, advocacy, and the future of nursing. Whether you're a clinical nurse, nurse leader, or another healthcare changemaker, Love and Leary offers thoughtful dialogue and practical takeaways to inform, inspire, and empower nurses at every stage of our careers.
All right. Hello, everyone. Hello, Rebekah. We are back with the Love and Leary podcast. And today we're joined by two nurses who I was incredibly inspired by when reading a story on NPR the other day. And they have graciously agreed to join us here and talk about that story. So they are both nurses who recently resigned from the United States Public Health Service. And they're going to share the story about what they experienced, why they resigned, and hopefully we can have a conversation about what we can all do next. So, Dena, do you want to introduce yourself and tell us a little bit about your background?
Sure. Thanks so much. Thanks for having me. My name is Dena Bushman. I am a nurse and nurse practitioner. I started practicing about 15 years ago in many different settings. I joined the United States Public Health Service in 2019 through a fellowship called the EIS, Epidemic Intelligence Service Program, which matches clinicians and PhDs in public health largely in placements to do applied epidemiology. I matched in New York City, so I relocated from California, where I was practicing clinician, out to New York City. I was there when the pandemic hit and served during that time with the New York City Department of Public Health and Mental Hygiene. And then I relocated to Maine, where I currently am now. I was embedded as a career epidemiology field officer at the Maine Center for Disease Control, which is the state health department in the state of Maine, as a federal assignee. And then about a year and a half ago, I obtained a position with CDC headquarters, remote from my home in Maine, leading a team to do sexually transmitted disease outbreak preparedness and response work, and was there until January 6th when I resigned.
Great. Thank you. And Becky, do you want to introduce yourself, and then we can start having a conversation about all of this?
Sure. And I just want to thank you so much for having us on and giving us this platform. So I have been a nurse for a little over 20 years. I started out my nursing career as an ER nurse and a rapid response nurse. I worked at ERs across the country, mostly level 1 trauma centers. And then I went back to school to become a nurse practitioner, got a master's in public health at the same time, and really pivoted my career towards public health at that point. So it was kind of like midway in my career. It was right around the time that the Ebola pandemic was raging in West Africa. So I was able to work with Partners in Health over there before I started the same fellowship that Dena started that brought her into CDC, the Epidemic Intelligence Service Fellowship. I was at headquarters the whole time, CDC headquarters in Atlanta. I started out in the influenza division and then moved over and worked in the division of tuberculosis elimination for the rest of my career at CDC. I had a variety of roles there. Most of my time was spent on the outbreak investigations team. So we would investigate tuberculosis outbreaks that were happening domestically around the country, and provide technical assistance to the state and local health departments. And then I led our national tuberculosis surveillance for the last couple of years. I joined the United States Public Health Service when I started at CDC, really because as I think an ER nurse, I wanted to have as many opportunities as possible to deploy and be of assistance during public health emergencies. And that seemed to be the best way to go about doing that, was that in addition to my work in public health at CDC, doing infectious disease related projects, I could also, deploy for public health emergencies like hurricanes and otherwise. And so I was with the Public Health Service, rising to the level of commander and with CDC until I resigned on October 25th, 2025.
I have to tell you, ladies, your careers are so incredibly impressive. Careers I would dream of having as a nurse practitioner, the impact that you've made both not only in the United States, but globally, but also for our profession to put nurse scientist and nurse practitioner and leading, nurses into these positions was absolutely important and imperative. And my guess is this is sort of your dream career. So I think Marion and I are here today to understand you had built your life around the work that you were doing. I always find that nurses live their mission much more powerfully through the careers that they have in ways that inspire us because it speaks to a future of a better human health system. And you guys have walked away just recently into these careers that you had devoted your lives to. Can you give us insight and step us back into what was this decision? What was these moments in time? Because today I think we want nurses to hear the true stories of what is happening within things and causing these conflicts internally for ourselves. So Dena, Becky, please dive in on this career that you've had and making what I would have to imagine is one of the most difficult decisions of your careers to do and step back from this career that you've pursued.
Certainly, working at CDC and even getting into the fellowship that I got into was a career achievement I never expected to achieve. I was the only nurse in my class of about 80 people. Everyone else had a doctorate degree, either physicians or a PhD. And then, as I stayed at CDC, it was really amazing to meet nurses, physicians, PhD scientists, and others there. And I remember thinking when I started there that I had really met some of I had met my people, these felt like some of the best, the people that I met and worked with at CDC were the smartest, the best, the most compassionate, the most engaged humans I had ever met. And that stayed true throughout my time at CDC. And it's really what, took it from being this pie in the sky dream job to being a place that I really loved to work and a place where I felt like the mission was really important. So yeah, making the decision to leave CDC was honestly one of the hardest decisions I've ever made in my life. I cried about it a lot. I thought about it a lot. I talked to a lot of people about it. I really labored over the decision. But my job at CDC was tied to my being commissioned as a U.S. Public Health Service officer. They were not two separate things. So I couldn't stay at CDC and I couldn't leave public health service and stay at CDC and in this, current situation, current environment. And so the public health service, when 2025 started and the policies changed regarding the immigration enforcement tactics, PHS officers started getting deployed to immigration detention facilities. And I saw the way that the ICE policies were being carried out in our communities and the way that they were terrorizing communities. And I knew that that was not something that as a nurse I could be a part of. And so it was that turning point that made me realize that this was no longer a career that I could follow.
Dena, please tell us your story, Becky. I can only imagine in that moment of time of standing at that moment and cost to step across a threshold that would put you in a place that had never served what nursing had always served to humanity. So Dena, tell us a little bit about your experiences in comparison with Becky.
Sure. Thanks, Rebekah, and thanks, Becky, for sharing your perspective. It's not dissimilar. So Becky and I only met recently. We were not in the same cohort in the fellowship. Becky was a few years before I started. And so it was a nursing work group at CDC that actually brought us together. Both of us were part of this leadership team. And it was through that experience that we built a friendship and a relationship, and then ultimately allowed us to really work together to try to navigate this really challenging situation and to find our way out. But just to back up a second, I'm not sure all the listeners are familiar with the United States Public Health Service. So maybe I can just provide a little background on that to frame the conversation. It's one of the uniformed services in the United States. It's largely composed of health professionals, nursing being the largest cadre within that the uniform service. All of the officers are graduates of a university, many of whom have beyond a bachelor's degree education. And part of our role is that we are deployable. Typically, there's a deployment cadence a few times a year where you have an on-call month where you need to be ready to deploy. The mission of the Public Health Service is to protect, promote, and advance the health and safety of the nation. And so, not dissimilar from Becky, when I was accepted into the fellowship, the Epidemic Intelligence Service Fellowship in 2019, previous to that, I was doing some public health work, also working clinically as a nurse practitioner in the San Francisco Bay Area. It was such an opportunity to join CDC. I too had always viewed CDC, and still do, as an institution of science, of evidence-based research, putting out guidance for clinicians and the public, where I would go to get information if I was traveling abroad on vaccines and what vaccines to request. And so when I got in, I too was the only nurse practitioner in my cohort. There were a few other nurses, PhD nurses, but I was the only nurse practitioner in my cohort of about 70 fellows. It was quite an honor, and I was so excited. And I had heard from others that, you could have your career at CDC. There were so many opportunities. Once you built skill sets, you could really move across or above, up, over, abroad, domestically within the agency. So I was absolutely thrilled to be part of that cohort and family. Really, it is a family, the fellowship. And I too thought, wow, what an amazing opportunity to be part of the public health service, which would enable me to use my clinical skills for emergency preparedness, emergency relief type work. I understood it to be public health emergencies, disease outbreaks, natural disasters. And so I could have my day job of doing medical epidemiology, and then I would get to deploy with a bunch of other clinicians and epidemiologists to areas that really needed our help in really dire circumstances. That changed, though, in 2025 with the change of administration. The types of deployments, the frequency of the deployments, and the quantity of officers who were being deployed was heightened and increased. I was terrified. I still am, of what I see in the news and the media and what I've witnessed here in Maine over the last few weeks, what I've seen, the images, devastating images from Minnesota over the last month. I just knew I couldn't be part of serving in facilities that were upholding the deportation and detention agenda that was terrorizing families, terrorizing communities. While I wholeheartedly believe that people in detention deserve care, I knew that I would be doing more harm than good by serving in those facilities. And I felt like if I was out and I could speak out and up and share the stories and not staff this facilities to uphold this agenda, that I could be doing more good.
So I'd like to talk about, from the NPR article, and this is widely known, last year was the deadliest year for detainees in those facilities. Were either of you deployed to any of those facilities? And can you talk about what the conditions are like for the detainees there?
So neither of us were deployed to an ICE facility. We were asked to deploy, or rostered, I would say, to deploy, both of us a couple of different times. And because we voiced our very strong objections to participating and met with our leadership and then, and then submitted our resignations, neither of us served time in an ICE detention facility this year. In 2019, I was deployed to Customs and Border Protection 2 different times as a public health service officer. So slightly different, right? These are, Border Patrol stations, once in Arizona and the other time in Texas. And what I experienced there did inform my decision about not wanting to participate again, because what I experienced there was that I was sent there as a nurse practitioner under the auspices of taking care of the people that are in those facilities and screening people for infectious diseases, which we did to the degree that we could, right? We took temperatures and asked, questions as they were coming in. But then we were given very little, if any, authority or ability to actually take care of the people that were, quote unquote, under our care. And the picture that stands out most in my head is being in a station where I could see the several different concrete cells sort of around me, because they, just had transparent, they just had glass walls. And one of them had probably 50 women crowded in one concrete cell with, they're sleeping on the floor. And I had no power to change their situation. And I have said this before, but, I felt like the most impactful thing I did during my 2 weeks there was, after the first week, convince the CBP officers to let them take showers at the sort of portable showers that they had outside the station. And so, recognizing that I could try to do a lot of good, or I could try to, act with care and compassion when I was deployed. And I truly believe that all of our fellow officers who are being deployed are doing that to the very best of their ability. But there is only so much you can do when you are embedded in a system that is designed to crush and terrorize people. And I couldn't be a part of that. Now, I do think we know, as from hearing some of the other stories from our fellow officers, some that have spoken out anonymously for these reports, that, they have reported that there's delays in people getting medical care for kidney stones, for, broken bones, that there's a lot of distrust of the reports that detainees are giving to the medical authorities, that they are being asked to facilitate really fast deportations, meaning having to do health screenings of large numbers of people without like the very basic confidentiality standards. So people having to ask and answer very intimate questions about their health and life in front of several other people. So, I think we've heard a lot in the news about what it's like in some of these facilities. It's really awful to think about.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
Well, I want to just say, thank you both for your service. Thank you for speaking up. And I can't imagine, and you've already sort of said it, how difficult it must be to know that there are all of these individuals who need care and are not able to get it. And it's just, to the point of that NPR story, the moral distress must be overwhelming. Dena, do you want to talk about some of that?
Sure. Thank you. And thanks, Becky, for sharing your experiences from 2019. As Becky mentioned, I too was rostered to deploy in April to an ICE facility in Texas. And then in August, I was rostered to deploy to Guantánamo Bay for 5 weeks in October. Both of those I did not end up serving there, and I ended up resigning. I had spoken with a number of officers about their previous experiences in detention and deportation facilities and heard stories not dissimilar from what Becky has described. And then reading the NPR article very much validated my concerns, which was, overstaffing, under-resourced, overcrowding, not able to get insulin or anti-epileptic medications in a timely fashion, reading about the number of deaths this last calendar year in ICE detention facilities. It just is horrifying and also validating to hear what's going on, and a very vivid picture of, the limitations, the powerlessness that some of these clinicians that are serving in these facilities and the difference they're actually able to make while there is very concerning. And, as I was navigating the last year, it wasn't so clear that leaving was the best answer. It really was this push and pull of how can I best serve as a nurse practitioner, as a bilingual Spanish speaker, as a public health professional, as a human? Where is my moral, ethical obligation, both as a professional and as a human? And really, it was a very challenging time. And that's on top of the moral distress that our colleagues at CDC and federal workers are experiencing just in general, those that aren't part of the uniformed service, but just those in the civil service that are experiencing. It's been an incredibly hard year. I can speak most clearly to what's happened at federal CDC, reductions in force across the agency. I lost 60 of my colleagues to the reduction in force. I was the only person left in my office on April 1st. And that was incredibly incredibly devastating. The loss of knowledge, the loss of their careers, the loss of the work, and all the trickle down, the impact across the country that was then felt as a result of the mass layoffs that occurred. And then the mass shooting event that happened on August 8th, hundreds of bullets shot at CDC offices in Atlanta and resulting in the death of an police officer. Really, really devastating. And then on top of that, these deployments and what's happening with detention and immigration agenda across the country is really, really challenging. And Becky and I worked really hard to support one another and to work with other officers who we thought maybe felt similarly, had similar concerns, and to speak up with our leadership within the public health service to understand, could changes be made? What was the future of deployments going to be looking like? What power did we have if we were witnessing something that we felt was inhumane or unethical, or being asked to do something that we didn't agree with? What was our option? And while we were met with an open door and our colleagues, our leadership did hear us, ultimately not much resulted from it. They really didn't have a lot of information or transparency from headquarters that they could share with us. They felt that some officers felt that, serving in facilities was part of the mission, was treating vulnerable populations. And so there wasn't a complete alignment across all officers that this was in conflict to the mission of the public health service. So, Becky and I did try hard to work within the system to make changes, to advocate. And ultimately what we learned is that there weren't going to be changes made in a timely fashion. I'm not sure about the future, but at the time, we were told that this was the future, this was the priority. And because of that, I just knew that leaving really was my only option. And as hard as that was, because it was the career that I had hoped for, and I was surrounded by such amazing, smart, dedicated, compassionate professionals from all different sectors. And I saw a trajectory that allowed me to really grow professionally and to still see patients part-time. I mean, I really felt so lucky to find this intersection of public health and clinical practice, which was always my goal. I always wanted to find that intersection, and I had. But I ultimately knew that leaving was my only option.
Listening to both of you, the moral distress of being in that moment of alleviating human suffering, and Becky, your story of, the most impact that you could have is watching 50 women crowded in a small cell to be convinced to give basic access to a shower for basic human hygiene, to stop the spread of disease, that even the most basic levels of hygiene were being denied to people in quarantine conditions, even though the science and the research, and it's just showing, and most recently, I'm sure some of you, maybe in regards to that, we just recently heard from an Irish citizen who has been held down in an ICE deportation center in the course of the last couple of days, about how he is saying this is the most deplorable of conditions that exist in our current situations that are going on. I think that what is your moral distress as nurses, the compassion that we've always had for patients was to alleviate suffering, take care of the sick, and heal what we can. And in those situations, it has not often come back into the environments that we work on that the most basic need of personal hygiene, the most basic premises of stopping the spread of disease are not even being maintained in such centers. So to your points, the more complex cases of not having access to insulin or the medications to keep people alive were so far from being able to be impactful that you were going back to the basics to try to alleviate the number one cause of infectious disease spreading. And I think what I would just say to all of you and that are listening is that the duties of nursing transcend aspects of humanity that we often take for granted, and the moral distress that you both were facing in those situations. And I'm sure you had internal discussions internally, which were, do I stay or do I go? Because if I go, who is left to care? And, I think those are the moments that, there comes a point in all of us. And I think this is what has been interesting for Marion and I to have these discussions is, where is the line in the sand and what actions do we take when and where? But, Marion, what are your thoughts here?
Yeah, it's a great question. Like, where is the line in the sand? And it's going to be different for everyone. I guess my question to you both is, now what? Like, now as a profession, what do we do? As individuals, what's your plan moving forward, both professionally and, specifically related to what you know about what's going on in these detention centers? How do you feel like you can continue to push for the care that these patients desperately need outside of a system you are no longer able to function in. And Dena, why don't you go first, and then Becky, please join afterwards.
So I will say that, in my decision was that if I were to go and staff as a medical provider, as a nurse or nurse practitioner, that I would be upholding this inhumane and cruel administration's deportation and detention agenda. And I understood that there's national detention standards that do require medical care at a certain ratio, and that if I wasn't there to staff, if they didn't have the staffing ratios necessary, that they couldn't legally operate. And so that was also part of my decision-making process, just to make that clear. What I'd love to say to all the nurse listeners is that you have a voice, and your voice matters. We are one of the most trusted, if not the most trusted profession in the United States, and that's been well researched and well documented, and that your voice matters. And whether you're working independently or working with a colleague, like I was lucky enough to find Becky to speak up together, your voice matters. And if you can find the courage to speak up, that might ignite others to speak up. And I would really encourage you to think critically about what you're asked to do, no matter what the setting is, whether you're a bedside nurse, outpatient practicing nurse practitioner, or working in public health, working in policy, whatever it is you are working on, understand what your own moral and ethics are. And if you're being asked to work in a way in which that compromises those moral and ethics, stop and reconsider if moving forward with whatever you're being asked to do is the best way forward. And if it's not, don't be afraid to speak up. And you can do so in a very professional way. And I think that it can really invoke a lot of change. And so I'm really hopeful that now that I have resigned from the public health service, I can speak on platforms like this, speak with reporters, share the message that critical public health resources are being used to uphold this inhumane and cruel agenda. My colleagues, public health service colleagues, are being utilized to staff these detention and deportation facilities. And my real concern is we are going to have an outbreak. We have an outbreak, a measles outbreak currently in the United States. And is public health service going to be able to support that need or other wildfires, hurricanes that are to come? I just don't know. For me, my next steps are professionally, I have accepted a position that I will start in about a week doing addiction medicine. So I will be working in population health, providing direct patient services for patients who have opioid use disorder and who are in recovery, and also helping them innovate other models of care. So I'm really excited about that opportunity, leveraging my clinical and public health skills in this new way. And, I would encourage people to vote, to call your representatives, to sign the petitions that align with what your beliefs are, to donate to organizations, if you can financially, that help people in crisis. And I would also encourage people to volunteer, to attend protests, to protest safely, to have your voice heard.
Dena, so well said. Becky, final thoughts that you would share with nurses listening and your next steps in this time.
Yeah, well, Dena just spelled it out so beautifully. I think it's important for us as nurses right now to expand our idea of who is our patient beyond the person that we might be taking care, the individual we might be taking care of us, right? In front of us, whether that's in the office or in the hospital, and to think about that we are here, that we have the ability to protect and promote the health and safety of the nation and our communities. And so really thinking about our patients as the communities that we live in. And so I think there's a couple of different ways that we can do this, and a couple of different ways that I'm trying to do this. So one is to get involved in organizations that are very local in my community, even sort of grassroots organizations of people who are trying to figure out how can we best protect our neighbors and take care of each other during this time. That's one. And then on the other side, recognizing that really all of this is due to policy changes, right? And policies can change if enough people speak out against them or enough people educate and raise their voices. And so I think, as Dena said, nurses are the largest healthcare workforce. We are also the most trusted voice. Use your voice to speak out, to, be part of the people who say, ICE is making our communities less safe and less healthy. And as nurses, we won't stand for it. I'm trying to do both of those things while I can. I will continue doing them. I'm still looking for a job. I took a little bit of time off to take a breather and get a little bit more involved in my community. And then now I am thinking about what I want to do next. Ultimately, I'd really love to work sort of at the forefront of health justice. And so looking for organizations that are doing that work. But yeah, thank you so much for having us.
Yeah, we, again, really appreciate you speaking out. Look, we are in a very critical time. History is going to look back, and we're all going to have to, be okay with how we responded, right? And what you all are doing is really leading the way and showing that, we can't sit by and condone the actions of this administration, of the immigration and Customs, Border Patrol. What they're doing to humans is just, it's deplorable, and really appreciate you all taking this stand, leaving positions that you clearly are so passionate about. And our country is worse off because of it. The individuals in those detention centers are worse off because of it. But what you're doing is incredibly brave. And really, thank you so much. I'm sorry you're going through this moral distress, but really appreciate you taking the time to share your story with us and to highlight what is going on in the detention centers and with the public health service and everything that's going on this past year with this administration.
And just echoing what Marion just said, Becky, Dena, you represent the best of our profession. Your intelligence, your careers, the impacts that you have made, not only on nursing, but on the future of human health, is going to stand a testament of time. Know that the impact that you're doing by speaking out and having today is going to change and help change the policies that we need you in. I wish you both the best of luck in the next stages of your career. I have no doubt we will see you on the national and international stages for the impacts that you are making. And it is an honor and a pleasure to have you guys have spent this time with us. And know that it is bravery by nurses across history and time again that help us shape for a better humanity that we have going forward. So Becky, Dena, thank you for spending this time with us. I hope it is, leading to further discussions and conversations that need to be happening across the national narrative of nursing. And to each of you, Marion and I have absolutely enjoyed being with us. Marion, I'll turn it over to you.
Yeah, just thank you again. And we look forward to continuing to follow the work that you're doing. Thank you all for joining us again with the Love and Leary podcast, now on Nurse.org, and we will bring you more content in these areas in the coming weeks.
Thanks for listening to the Love and Leary podcast. We hope this conversation sparked new ideas, challenged your thinking, and reminded you of the power nurses have to lead change.
If you enjoyed this episode, be sure to subscribe, leave a review, and share it. You can find more episodes and join the conversation wherever you do your podcast listening.